This is a modern cardiac cath lab. It's probably one of the most modern ones in the city at the moment and offers full cardiac, vascular and electrophysiological facilities. So in this cath lab we can do all cardiac cases. It's also a hybrid lab, so we can do vascular cases, and we've got full facilities to do electrophysiological studies as well. So it's going to be manned by a group of very experienced cardiologists, and in this facility we will have an electrophysiologist to back us up, who is probably one of the most experienced electrophysiologists in the country.
In my field of interventional cardiology, I'm responsible for placing coronary stents into coronary arteries. The cath lab C-arm is a state-of-the-art biplane machine capable of doing both coronary interventions as well as structural interventions.
It's very up-to-date equipment. It's the Siemens lab just being installed. We offer everything possible, and we're complemented by a surgical team.
So what we're going to do today, we're going to do a test that is called a diagnostic cardiac electrophysiological study. This involves placement of instruments called catheters. These are soft, flexible, tube-like structures which we insert through the right groin, a vein in the right groin. We insert it all the way up into the heart. And these catheters have sensors on the tip, able to read electricity inside the heart.
Rondebosch, I'm very happy to say, has got the state of the art in terms of equipment and in terms of staff to fulfill those desired functions.
With the opening of the cardiac catheterization lab, it affords us the opportunity to now see a broad base of cardiology patients as well. Everything from people that come in with heart blocks all the way to acute, MIs as well. And now we have the opportunity to also put ourselves onto the same level where we can deliver somewhat of first world medicine now.
Today's case, we treated a lady with fibroids. The other name for this condition is myoma or leiomyoma. And what's really important to understand from a patient's point of view is she's not cut open, she's not operated on, her womb is left intact, her ovaries are not affected.
We've got a huge range of technologies in here which allows us to treat the full spectrum of heart rhythm disturbances. So we can open blocked arteries, we can repair damaged arteries, both in the heart and in the periphery, such as in the legs. We can fix heart rhythm issues, we can place pacemakers, and there are even more sophisticated devices which are life-saving now called defibrillators. We can place those here too. So we really are in a position to treat all the life-threatening cardiac problems that we face with.
The patients will really love this facility because it's fully equipped and it's modern. This is one of the most modern facilities that we have in the city. So I think from the patient perspective, the cath lab is spacious. The facilities before angiography and after angiography are staffed by very capable, so patients shouldn't have any problems coming to this facility.
I spent quite a bit of time in this theatre complex doing endoscopic procedures, which is what we specifically do in this hybrid theatre here. It's one of the more complex endoscopic procedures we do.
Our cardiac theatre is actually attached to this facility right next door. So that's one of the unique features of this facility.
And I think we've now got a service that we're able to offer and deliver to patients which is of quite a high standard. And I think from that perspective it will be both a service not just to the general community but also to doctors that are referring in as well.